Hey, it's Miss Bynum again. We are going to teach you how to do a 12-lead EKG, okay? First off, we would like to apologize for the fluorescent lighting because it makes everybody look terrible. Let's get started. Okay, first off, we just came from the classroom and where I have showed you how to put on a 12-lead EKG, right?
Yep.
My name is Miss Bynum. This is Will, my student. This is Cruz, my other student, and he has volunteered being a sport, letting us do an EKG on you today. Okay? So, here's a trick. Since he keeps falling down in the bed, this is what I do for a lot of my patients, or I did in the real world. If you raise the bed up a little bit in these ER stretchers and tilt it back, see that? Now when you scoot your bottom up to here just a little bit. There you go. He won't slide down. If you just elevate him a little bit and it kind of puts everybody at ease, makes them feel like they're in a recliner. So that's a little fun fact. Okay, so here's what we will do. I am going to go through and show the 12-lead EKG. Will has the steps right here on his clipboard. I have the steps right here on my clipboard. When I'm finished, you all will partner up and you'll literally stand just like Will is and make sure I'm doing them right. If I don't, you correct me, and that's fine. And we back up and we make sure we get them right. You want to practice it right every time so you mold yourself into getting good habits. So, first off, I'm so glad you all made these beautiful posters for your lab because that is the first step. It's a critical step. You have to do it for every single patient no matter what, okay? So, you will literally, sorry, I'm going to come in front, you will, K, wipe, K, knock on the door, come on in, grab the alcohol, wash your hands, and then we're going to introduce ourselves and identify the patient. Hi, my name's Chrissy. I'm going to be your CET today. That's an EKG tech. What is your name? Do you mind if I check your wristband?
I don't care.
And yes, he's got a wristband on. Okay, so I would check it and it would say Cruz Bynum. How old are you?
7.
Okay, and I'm going to check the date as well, just a few things, and make sure we're good to go. So I've introduced myself, I've identified the patient. Next, I would provide for privacy, either close the door, but I'm going to pull that fake curtain. Okay? And then the next thing is E, and that is for explain the procedure. So this is how you can go about that. Hey, Cruz, have you ever had an EKG before?
Yes.
You have? Okay, well good. Then you know that it's painless, doesn't hurt. I'll put some cold stickers on your chest, arms, legs, attach it, we'll take a big picture, and then boop, done. Okay? Sound good? Okay, I'm ready to roll. I have come in, check it out, Will. I did step 1, the K-White protocol, and then I went on to step 2. I made sure everything's good. Step 3, I got the patient lying, reclined on his back, so we're good to go. I'm going to go on to step 5, okay? Or step 4 and 5, I'm sorry. Okay, we talked about finding intercostal spaces. That's that meaty part in between your ribs. Remember, we felt ourselves out there, and we've found our clavicles, and then we went down one, you felt the meaty part. Then you feel that hard bone, that's your rib. Come on down, you feel your intercostal space, and you're going to count 1, 2, 3, 4. There is nothing easier than finding intercostal spaces on a pediatric patient because they're not as meaty as adults, okay? And that's perfectly fine. So, Cruz, I'm going to just ask you to put your hands at your side, please, sir. And I'm going to go ahead and find his clavicles, and they are right here. These are your collarbones, clavicles, and they're ticklish. Now, I also said, but now you'll see once we get in here, you don't want to find the spaces like this with the tips of your fingers. When you do that to yourself, it hurts. If you put your hands flat on their chest, it does not hurt when you feel around. Especially if you have a fragile little elderly patient, they don't want you digging with your fingers, okay? So, here's what we do. I'm going to find his clavicle on the right side, and then I'm going to count down 4 spaces. Here's 1, 2, 3, 4, okay? Here's his 4th intercostal space. It is right here. And I'm going to take my beautiful leads here. And I will place that cold little electrode there right to the right of the sternum. I know it is cold, I'm sorry. You can bring that over, and you should feel your next 4th intercostal space right there to the other side of the sternum. And we're good. It's just cold. Okay. And then, here you go. Okay, now this is where it gets a little bit backwards and tricky and weird, but it keeps everything in check, okay? Right here you should be at your 4th intercostal space, which we are. You dip 1 down, there's your 5th, and you come right to the nipple line, okay? You go right below, go right there at the nipple line, between the nipple. And then, all you do, you don't even really have to feel it, you're just going to throw that right in between V1, V2, V3, V4, okay? Then here's another weird, tricky part, but you'll get used to it. You're going to take a look at their armpit, your armpit, axillary area. And you're going to come down here in that little intercostal space here, place a cold electrode, and then throw one right in between them, okay? So you will have V1, V2, V3, V4, V5, V6. Okay, lower your arm, sir. And then these are easy ones. We're going to place it, you can do them on the wrist if they have an amputation that is below the elbow, you can place it up here. If they have it up there, then you can place it here, and then sometimes mine, you can place it here. But we will talk about that at another date, okay? All right, we're going to place one here on your arm. We're going to place one here. And then we're going to do one on your legs. You want to make sure when you're placing these on the limbs that you want to get the beefy part, the meaty part. You don't want to put it on the bone, okay? It will interfere with your reading. So we just want to place them on the meaty part of their legs, okay? And we are ready to apply the leads. Do I leave this sitting here? Yes. And I'm going to tell you why. If he had blankets and everything and I thought it might get lost, we can leave it sitting right here. But when we go to take the electrodes off, we're going to take them off and place them back, and that way you don't leave any on anybody's skin. But for today, we'll go ahead and pop them right there, okay? So here we go. Now you get to play with these crazy wires. Okay.
Play with
Yeah, you kind of do. Okay. Cruise is fabulous enough to let us do it without a gown, but if we had a gown and stuff, we would want to make sure that we keep the patient covered. And I don't think I said that, so I apologize. I want to make sure I said that. Okay, so here we go. I already know where they're going. We're going with V6 right here. Now you can do this in any order you would like as long as you get them on there, okay? Oh, look, see that one already fell off. That's okay. I'll get it back on there. V4. That one just does not want to stay, does it? But that's okay. It's all about troubleshooting. V3. V2. V1. Okay, we'll go ahead and throw this on your right arm right here, sir. V5, we'll try to put that bad boy on there again, okay? There we go. Let's see, left arm. LA is pretty simple, left arm. RA is right arm. And then guess what right leg is?
RL.
Yes, Will, you are so smart. LL, like LL Cool J. You're so smart, I tell you what. Okay, I'm going to check these. Let's see. This one just does not want to stay on. We'll have to check this bad boy. Now, if you're in the real world and this stuff will not stay on or you got something crazy going on, you can always take your tape and tape it there, and it will work just as well, okay? I've already put his stuff in the computer, so we will go on. Exit through. Okay, now, this is very super important, okay? Just close your eyes and don't rub them. I need you to sit still, and in your mind, I need you to go to the beach and totally relax. This is not going to hurt, but I don't want you to move and wiggle because it'll interfere with your test. So when I say go, you just be calm, okay? Ready? 1, 2, and well, I'm going to have you step away from the bed so you don't shake and stuff. Here we go. And go. I just want you to go somewhere like camping or the beach or wherever likes to. And you were so good that it printed off just like that. Bam. When we have our EKG. You can move now, sir. You can open your eyes and keep on rubbing that eye if you'd like. I know, it's allergy season. Killing us. Okay, now when you're finished, you will take these off. You can detach them all. See? Not bad, huh? And then remember, I already showed you that little trick. Hang on. Hang on. We're good. I got to get your stickers on. I already showed you that little trick. You just want to kind of hold his skin. This gel is not made to pull your hair out or hurt or be painful, okay? And I'm going to place him back on this pad. Oh, and if you'd like to help, that is fine too. I'm going to place him on the pad. Keep them in order so I don't forget any, because if you left this on a geriatric patient or, you know, a chemo patient or anybody with any kind of skin cancer, fragile skin, anything, lupus, any type like that, it can really hurt their skin, or if they're allergic to latex and all that good stuff. Okay, hang on, please. I'm going to have you to still sit here. So, I got them all back on there. I'm not missing any, and I will discard those in the trash, wash my hands, give him the call light, see if there's anything he needed. And most importantly, I'm going to go out and interpret this EKG. And that's all. Thank you, Will. Thank you, Cruz.